I'm Dr. Michael Aziz. I'm the president of the board of No Polyhydramnios. We're looking forward to helping moms, their families, and their children with better outcomes through research and advocacy regarding polyhydramnios. Polyhydramnios is when there is a buildup of too much amniotic fluid in the middle of a pregnancy. Sometimes after having a pregnancy complicated by polyhydramnios, your baby can have lifelong problems. Sometimes there is developmental delay, sometimes there's neurologic or muscular issues, and sometimes there are underlying genetic issues.
I decided to start No Polyhydramnios about a year ago. I wanted to start a website to gather accurate information for moms because there was so much misinformation on the internet. Then I met Megan, and together we just decided to turn it into an actual nonprofit organization so we could really start to fund research and do more to help these moms and these babies.
My son has experienced a wide variety of symptoms from the past year that if we had early intervention from people like occupational therapists, physical therapists, speech therapists, right from the onset, so many symptoms could have been alleviated and my son could have been thriving sooner. So when I took my symptoms to our pediatrician saying, Teddy isn't swallowing, Teddy isn't sitting up, Teddy is crying in pain for days on end. And I always led with, I was a patient of severe polyhydramnios. And they didn't see the correlation at all that complications can result from the diagnosis of polyhydramnios.
One of the big problems with doing research for polyhydramnios is that many different things or nothing can cause polyhydramnios. So it becomes very difficult to study because a lot of the research is done for each individual diagnosis instead of polyhydramnios as a whole.
So what No Polyhydramnios is trying to do is bridge this gap between care for the mother when she's diagnosed with polyhydramnios to care for the infant from their pediatrician on the other side of the pregnancy.
More research would better inform parents for what to expect whenever their baby is born. It would also help them to ask their doctors more questions about if this could be a severe form, which might lead to an abnormal outcome for their child.
So we need to get earlier intervention and the right testing for these babies to really, really help them thrive.
I'm a high-risk pregnancy doctor, and I believe that women and infant health matters.
I'm a poly mom, and I believe that women and infant health matter.
I'm a poly mom, and I believe women and infant health matter.